Hello and thank you for joining us for today's Feed Your Mind webinar. This series is part of Age-Friendly Arizona. We are a network of communities dedicated to connecting older adults with people of all ages. Age-Friendly Arizona is supported by partners statewide and beyond, including AARP-AZ, Virginia G. Piper Charitable Trust, and grant makers in aging. Please check www.connect60plus.com for news about upcoming webinars and for recorded webinars that have aired previously. Hello, welcome to the webinar of the Arizona State Health Assessment presented by the Arizona Department of Health Services. My name is Sheila Sjolander. I'm the Assistant Director over the Division of Public Health Prevention Services.
Hi, good morning. My name is Carla Berg, and I'm also with ADHS as the Chief Strategy Officer.
Carla and I will be tag teaming this presentation as we move forward. We will be starting with background information about the State Health Assessment. First, the framework that we use. This is essentially a planning framework where we assess health needs with data, also assess capacity, look at matching needs and capacity, and set priorities and performance objectives for moving forward. So this informs the work of our State Health Improvement Plan. The State Health Improvement Plan was first produced in 2016. This followed the completion of our very first State Health Assessment, which was completed in 2014. So the State Health Assessment that we're working on right now and will be publishing in the spring of 2019 will actually be the second State Health Assessment, and we update it every 5 years. So the Arizona Health Improvement Plan includes 10 priority areas that were published in 2016, and we added a couple of additional health priorities in 2017 and for what we call cross-cutting issues because they impact a multitude of health issues. We added 4 cross-cutting issues in 2017. So that comprises our Arizona Health Improvement Plan. And we recently updated the Health Improvement Plan just this past summer. You can find it on our website at azhealth.gov/AzHIP, looking at the Arizona Health Improvement Plan tab for the new 2018 update. So the Health Improvement Plan comes with a framework and vision of healthy people, healthy communities. So in terms of framing the State Health Assessment, we use the same vision to frame the State Health Assessment. So we're looking at healthy people, and rather than looking at specific diseases or conditions, we wanted to take a more holistic approach, and we're looking at outcomes across the lifespan. So maternal and child health, healthy adults, and then healthy aging. For today's presentation, we'll be primarily focused on adults and aging, but the entire State Health Assessment document, which will be produced in 2019, will have a full spectrum of data included in it. We also will have a healthy communities component that focuses more on how where we live influences our health, those social determinants of health and influence tribal health and other special populations. And then we'll have a section on opportunities for health. So just to touch briefly on some of our main data sources that we're using in the State Health Assessment, there are several data sources that we'll actually use in the health assessment, but these are 3 of the main ones that we use. The vital records, which are birth and death certificates that are filed with the Arizona Department of Health Services. The behavioral risk factor surveillance system, which is a random telephone survey that's done in Arizona as well as nationally, so we get comparisons and trends over time. And then the youth risk behavior surveillance system, which is a survey completed in a small sample of schools every other year. So that we have for Arizona as well as nationally. So starting with healthy people, looking at just in terms of the population of Arizona, we have the sixth fastest growing population in the U.S. In 2017, we had just over 7 million people in Arizona. So we're seeing a population growth of an average of about 1.4% every year. In terms of the populations that are growing the most in Arizona and population changes, we see that for people ages 65 and older, having the largest population growth at 36% population growth among that population. And then you can also see that the population of infants has actually decreased over time. So we're seeing a decrease of 2% in the infant population. And again, looking at ages in Arizona, you see the highest percentage of Arizonans are between the ages of 20 and 44 years old, with 24% between ages 45 and 64. When we look at race and ethnicity, we see that the white or Hispanics make up about 85% of the population, with Hispanics at 31%. African Americans, 4.3%. American Indians or Alaska Natives around 4%. And Asians around 3%, and multiracial about 2%. So, but in terms of looking at population change, the fastest growing populations we see in Arizona are Asian and multiracial and African American. So we are becoming more diverse in Arizona, but again, these populations are small in comparison. In terms of how the population looks across the state, over 75% of Arizonans reside in Maricopa and Pima counties. So you can see Maricopa has a population of just over 4.25 million. And Greenlee County has the smallest population with just over 11,000 people. So now we're going to take a look at outcomes across the lifespan. So here we're looking at a table of leading cause of death by age group in 2017. So what you'll find is the maroon colored is heart disease, the #1 leading cause of death in Arizona. The second leading cause of death in blue is cancer. Third leading cause of death in green is unintentional injury, which could include drug overdoses as well as falls, drownings, etc., motor vehicle crashes. And then the fourth leading cause of death in the light blue is chronic lower respiratory disease. And the fifth leading cause of death is Alzheimer's. So also you'll see by age group, 65 and older, heart disease and cancer by far claim the most lives, over almost 19,000 lives claimed just with those two diseases, followed by chronic lower respiratory disease and then Alzheimer's disease. And here we look again at the leading causes of death. First on the left, you'll see the by count. Again, heart disease and cancer claiming by far the most lives. Then on the right bar chart, you'll see leading causes by years of potential life lost. So that looks at life expectancy and which of those causes of death really result in years of life lost. So there you'll see unintentional injury by far having the most years of potential life loss at almost 89,000 estimated years of life lost, followed by cancer, heart disease, and then suicide.
Okay. Now we're going to take a look at, throughout our slides, we like to use some national comparisons when those are available. And so in this slide, you'll note the 2017 America's Health Ranking Annual Report focused on Arizona. And now we are expecting the 2018 report to be published here shortly, and we will update this slide when it's made available. But last year, Arizona ranked 31st, according to America's Health Ranking Report across the country. And in the green side, you'll note positive impacts. So those are areas or measures where Arizona is standard deviations better than the national average. And then in our yellow-orange color are our negative impacts, or where we fared worse than the national average. So for our green positive impacts, we have smoking rates, which are doing well. We have preventable hospitalizations among our Medicare population, as well as cancer mortality, cancer deaths, and the positive impacts. When we look at our negative impacts, we have a lot of opportunities in areas to improve in our air pollution, children in poverty, and high school graduation when compared to national average. So we'll explain and provide statistics and greater measure information on some of those impacts. When we look at our adults, so here we're going to focus on our adults 20 to 44 on the left-hand side. So you'll note the leading cause of death for adults 20 to 44 is unintentional injury, followed by suicide and cancer. Then when we look at slightly older adults, looking at 45 to 64, cancer and heart disease become the two leading causes of death, followed by unintentional injury. Looking at our unintentional injury, the third leading cause of death for all age groups, it is the number one leading cause of death for those 20 to 44. And what we see here are poisoning and motor vehicle accidents account for the greatest years of potential life lost, with poisoning deaths including opioid and other drug deaths in this poisoning type, and motor vehicle accidents at almost 150,000 years of potential life lost for Arizonans. Looking at our intentional injury or suicide mortality rates, that is an area where Arizona remains has higher rates than the national average. So suicide deaths accounted for the loss of just over 1,300 Arizonans in the last year. And what you'll note there, firearm, suffocation, hanging, and poisoning were the most common injury types leading to suicide deaths. Taking a closer look at our suicide deaths, we see here males in the blue accounted for more than 75% of the suicide deaths in Arizona in the last year. From 2012 to 2017, suicide deaths accounted for over 196,000 years of potential life lost. And what we see here, the highest rates are seen among men 55 to 64, as well as those over the age of 75. The next two slides will focus on cancer, and the first identifies invasive cancer incidence rates from 2011 through 2015. And what we note is that Arizona's cancer incidence rate is less than that of the national average. We do, although, know that in Arizona, not all cancer cases are reported, and that is an area for improvement in reporting. Adult cancer is a disease that can, but does not always reflect lifestyle choices, and what we see on the right-hand side is our invasive cancer incidence rates by county, and we'll note their highest rates in Mojave County at 452 per 100,000 residents. Looking at our cancer mortality, again, Arizona rates have remained lower than national rates, but what we do find is that it's important to note that screening for the screenable cancers, breast, cervical, and colon, can result in early diagnosis. when a cancer is diagnosed early, it increases the chances for survival. And again, when we note our map on the right-hand side of your slide, we'll note that Mojave County also has highest rates of cancer mortality when compared to other counties in the state. And this is an area where our overall ranking is better than the national average. So looking at Arizona, we rank 6th in terms of our cancer mortality rates compared to national averages. Switching over to our leading cause of death as a state, which is heart disease, we know that it is the second leading cause of death among 45 to 64-year-olds. And in 2017, it accounted for the loss of 12,285 Arizonans. We note that the trend is better than the national average for the last 5 years. And then when we look at our county distribution, we note again Mojave County has highest rates, followed by La Paz County. Looking at our diabetes mortality rates, here's where we see that we have higher rates than the national average. So our rate for 2017 was 23.8. And although we have seen consistent rates over the last 5 years, we do continue to still see disparities across counties. And here's where we have a shift over to our northeastern counties. So Apache County, Navajo, and Graham County have higher rates of diabetes mortality. Looking a little bit closer into our diabetes, not only do we see that county disparity, but we note that there are disparities in the number of people living with diabetes across our racial and ethnic groups, where we note that for American Indians, they are disproportionately burdened with over 1 in 5 American Indian Alaska Natives in Arizona living with diabetes. Between 2016 and 2017, the prevalence among American Indians increased, while the other groups saw slightly lower prevalence. And then looking at our asthma prevalence, here's where we have seen a decrease, and this is self-reported asthma from our BRFSS. So we are still looking to see, because we did see that drop from 2016 through 2017 from 14.6 to 9.8. We'll see if that continues as a trend for us in future years. But although we have seen a decrease in the number of people living with asthma, there are counties that continue to be impacted by asthma disproportionately. Most notably, Navajo and Pinal counties have the highest percentage of adults living with asthma. And here's where we will note in our map, due to the number of responses in some of our counties where the population is smaller, we did have to group our southeastern and western Arizona rates due to those. So you'll note here, western Arizona has 9.7% reporting asthma, and southeastern Arizona 9.5%.
Thank you, Carla. We are going to be moving on to looking at some of the behavioral factors that contribute to the most common chronic conditions and leading causes of death that we just highlighted. So starting with a metric that looks at being at a healthy weight, for Arizona is in the blue bar versus the U.S. in the silver bar. So you see that in 2017, about 33% of Arizona adults were at a healthy weight. So we do tend to have more adults at a healthy weight than in the U.S. as a whole. Then a look at smoking. So Arizona has lower rates of smoking than the U.S. And you may remember that from the Arizona Health Rankings that was displayed earlier. We have seen an increase in the past 2 years, however. We are currently, in 2017, 15.6% of Arizona adults currently smoke. You can see the differences among the counties with, and in some cases we have to combine the counties because of just lower numbers from the survey. So, but Yavapai County has a rate of 23% of adults smoking, compared to the lowest rates we're seeing right now are in Apache County at 10.7%. But there are significant disparities among people with different incomes and races and ethnicities in regards to smoking. So this bar chart is pretty stunning in what it shows with disparities among incomes. So you see that Arizonans who have an income of less than $15,000 a year have a smoking rate of almost 30% compared to people making $75,000 or more at less than 10%. And then we look at the differences among race and ethnicity. We see the highest percentage of smoking among the African Americans at almost 18%, followed by non-Hispanic whites at 16.4%. Then looking at the use of e-cigarettes for Arizona adults. So about 5.3% of adults in Arizona currently use e-cigarettes. This is a little higher than the U.S. average. And then you can see, again, differences among the counties, with the highest proportion of people using e-cigarettes in Coconino County at around 8.3%, and the lowest percentage in Apache County. Now we'll look at binge drinking. So binge drinking is defined as, for males, it's having 5 or more drinks on one occasion, and for females, it's having 4 or more drinks on one occasion. So Arizona has historically had lower rates of binge drinking than the U.S. Currently in 2017, about 15.2% of Arizonans reported binge drinking. We're still waiting on the U.S. data for 2017, but it has been increasing in recent years. And you can see, again, the differences among the counties. Maricopa County, about 16.1% of adults reported binge drinking. Again, Apache County has lower rates at 5.7%. And then a look at the opioid epidemic in Arizona. We declared a public health emergency in 2017 because of the increase in opioid deaths in the state. So this trend line is those confirmed deaths through death certificates. So you can see the huge increase since 2012 in the number of opioid deaths, and in 2017 it increased again for a total of 949 people who died of opioid overdoses. And you can see that of those, about just over 30%, or 344, were heroin deaths. But when we look at this by age group, really reveals that the opioid epidemic looks different among different populations. So among men, we see the highest proportion of fatal overdoses occurring among ages 25 to 34%, at almost 30% of the deaths occurring in that age group. With women, we see a much different picture, with the highest proportion occurring among 55 to 64-year-old women. So we think that this is associated with probably the type of opioid that men are using compared to women, with men having more illicit use of drugs, and women having more prescription drug use in those occurrences. So And the other thing to note, too, is that men in general have much higher rates of opioid overdoses, with about 60% of those occurring in men. And then a look at depression, and this is reported from the Behavior Risk Factors Survey, so it is self-report, but it asks if you'd ever been told you had a form of depression. So what we see in Arizona in 2017, almost 19% of Arizonans said that they had been told they had a form of depression. This is up from 2016. And then we see also a metric on frequent mental distress, which is defined as having, people are asked if they've had 14 days or more in the past month with significant stress, depression, and problems with emotion. So known as frequent mental distress. So among those people reporting frequent mental distress, we see the highest proportion among American Indians at 16.8%. And then a look at STDs in the state, sexually transmitted diseases. So those cases have tripled in the past 7 years, and you can see that how the distribution looks across the state. In Maricopa County has higher rates of gonorrhea in particular, as well as higher rates of early syphilis. And then we wanted to have a section included in our state health assessment related to veterans. We know that in Arizona, just over 22% of Arizonans 65 and older are veterans. So in examining the health status of veterans in Arizona, we can see from this slide that veterans are more impacted by disability, frequent mental distress, and skin cancer compared to the general population. So in addition, veterans report smoking more than the general population. So we also note that almost 500,000 veterans residing in Arizona, with the largest percentage, 37% being from the Vietnam era. Now a look at healthy aging. Like all of this was about healthy aging, really, but referring to specifically people 65 and older, heart disease is the leading cause of death, but followed closely by cancer, so you can see those two really make up the majority of deaths among those older adults. The next slide shows almost 4,000 Arizonans died due to chronic lower respiratory diseases in Arizona. So that includes things like emphysema, chronic bronchitis, asthma. We have rates fairly similar to the U.S. And then we see differences among the counties in terms of mortality from chronic lower respiratory disease, with Mojave County, Yavapai County, Graham County, Sheila County having the highest rates, much higher than Maricopa County. And then a look at Alzheimer's disease. It claimed over 3,000 Arizona's lives in 2017. We do have a higher rates of Alzheimer's mortality than the U.S. It is the 5th leading cause of death overall, and the 4th leading cause of death among people 65 and older. Maricopa County, the rate is 38.6, which compares to the highest rate in the state is Greenlee County at 62.8. And a look at stroke mortality. Unfortunately, that has been increasing in Arizona for the past 5 years. We had been under the U.S. rates for for stroke mortality. We'll have to wait and see what the U.S. rates come out to be in 2017. Again, there are differences across the state among the counties. Maricopa County about in the middle at 30.5, a rate of 30.5. So the next slide shows again, from the Arizona America's Health Ranking. This is specifically the senior report. So shows the most positive outcomes we have in terms of how we fare better than the national average. Where we have the most positive outcomes are with nursing home quality, hospital deaths, hospice care, obesity rates among seniors, seniors reporting high health status, preventable hospitalizations, and then where we see the most negative impacts, or where we have some of the worst outcomes compared to the rest of the nation, are with SNAP, REACH, the Supplemental Nutrition Program, food insecurity, healthcare-associated infections, frequent mental distress among seniors, the geriatric shortfall among medical providers, flu vaccine among seniors. That gives a really interesting snapshot of how we're doing as a state with our senior population compared to the rest of the nation. And then a look at specifically at some behaviors for adults ages 65 and older. We saw the smoking rates previously. As a state, we're at about 15.6% of adults smoking. When we get to the 65 and older age group, it decreases to around 10%. 1 in 10 people are smokers at that age. We also see about 33% of people 65 and older are at a healthy weight. And then again, this is one of our better outcomes compared to the U.S. is preventable hospitalizations. You can see from this slide a nice steady decline in the number of discharges for preventable hospitalizations, and this is specifically among Medicare enrollees. And then a look at deaths due to falls among older Arizonans. So obviously, deaths due to falls is one of the leading causes of injury death in Arizona. And in 2017, 1,076 Arizonans older than 65 died due to fall injuries. So this chart shows certainly that those folks 85 and older have by far the highest rates of mortality due to fall-related injuries. And then a look at arthritis. So this comes from the Behavior Risk Factor Survey. People reporting that they live with arthritis. Overall for the state, it's about 24%. But when you look at it by age group, by age 65 and plus, we see half of people in that age group reporting that they live with arthritis. And then a look at hepatitis C. You may all be aware that hepatitis C is a big issue among the baby boomers. So this chart bears that out, showing rates by the year in which people were born. So you can see the spike among people born in the mid-1950s. And then we see another more recent spike due to people born after 1978. So we think that's more related to increasing injection drug use. So we know that hepatitis C is increasing in Arizona and in the U.S., and Arizona does have higher rates of hepatitis C than the U.S.
All right, now switching over to our healthy community section. As we had identified earlier in our presentation, what we wanted to talk about is the impact of the neighborhood, impact on where you live, and how that impacts potentially from social factors or others. And so what we wanted to look at first is life expectancy. Now this is a visual that was developed through the Virginia Commonwealth University with Robert Wood Johnson Foundation, and it really looks at life expectancy in different areas. So what we know from Arizona data is that the life expectancy is 79.5 years, which is higher than that for the U.S. of 78.8. However, when we look at our county distribution, we identify in the dark blue our counties where life expectancy is lower than that of the Arizona average. And so what we identify here, Apache County has a life expectancy, adults have a life expectancy of 74.3. Additionally, we also know in Arizona the life expectancy for American Indians, Alaska Natives, falls 10 years lower than the state average. Now looking at a focused example at a certain zip codes within the Phoenix metropolitan area, what we note here for overall Maricopa County, the life expectancy is just over 80 years, but really where you live matters. So a 13-mile distance from the zip codes 85004 in downtown Phoenix to Paradise Valley, Scottsdale area of 85258 really could mean a difference in 14 years of life. So we see that between 71 years to 85 years. Looking at ability to access care, so what we're looking at here is first health insurance. And so over the last 5 years, we have seen an increase in Arizona residents with health insurance, initially starting in 2012 at 83% and ending up in 2016 at looking at just over 86%. But we still identify in our county distribution, specifically Navajo and Apache counties, that have lower percentages of Arizonans with health insurance. Switching over to our education level, what we note here, Arizona has higher percentage than national proportion of individuals who report that they have an education less than a high school degree. So just over 14% of Arizonans have less than a high school degree compared to 13.8 nationally. However, also from the slide, we'll note that our percentage of individuals, Arizonans with a college graduate degree, is higher than the national average. But we identified some racial disparities. So among Hispanics, those without a high school degree is more than 2 times as high at 34%. And additionally, 23% of American Indians have less than a high school degree. Looking at our poverty, Arizona is higher than the national estimate, with 17.7% of Arizonans living below the federal poverty level. Nationally, that's just over 15%. And when we look at our mapped county distribution, we note that that even increases more, almost doubles in Apache County, where that is 36.2%. Looking at poverty level among our Arizona adults over the age of 65, we note that just under 9% are living below the federal poverty level. What we also noticed is that for every 100 adults aged 60 and older living in poverty, about 50 of those participate in the Supplemental Nutrition Assistance Program. So as we noted below, that was an indicator where we had some opportunities. Arizona ranked low in the SNAP reach for older adults. And so where we see 1 and 2 being able to receive those benefits, nationally that's 7 out of 10 receive those SNAP benefits when they are in need of those. Taking a look at our unemployment for Arizonans, 4.6% of Arizonans are unemployed. And this looks at August data, but we will see some county distribution where our highest rates of unemployment fall in Navajo County. We will also note that just under 15% of Arizonans 65 and older are currently in the labor force with 14% employed. And now why do we talk about education and income and poverty? Well, we notice that here, looking at those who have less than a high school degree compared to those who have at least a high school degree, we know that 62% of those with less than a high school degree report having an overall good health status compared to almost 84% with those with a higher education. We see that same disparity with those at an income below $15,000. So what we note here is really that impact of those socioeconomic factors playing a role into how an individual reports their overall health status. Looking at another aspect of the social influences in poverty, we look at about 15% of households in Arizona face food insecurity. And we note that for our Arizonans over the age of 60, we're doing even worse than that measure. Food insecurity is estimated at just under 18%, which is higher than the national estimate of 14.7%. And so what we identify as food insecurity is defined by the residents having an uncertainty of having or unable to acquire at some point during the year enough food to meet the needs of all the members of their household. And this could either be due to insufficient money or other resources for food access. So the map on the right shows a distribution with the bright green areas, and those really are food access areas where there are opportunities. It indicates low income and low access to food at 1 in 10 miles as identified by USDA. Switching over to our homeless and the impact for health there, when we look at in 2017, the point-in-time survey identified just under 9,000 sheltered and unsheltered homeless individuals statewide. So you'll see in the tealish blue, we have our unsheltered, and in our green, we have our sheltered. And what we noted from 2016 up compared to 2017, we saw a total number of homeless individuals increased by 3%. Taking a look at how homeless impacts our aging adults, what we see here, so there are reports from 3 years, although the 16 and 17 numbers look exactly alike, but what we identify is that the number of aging adults in the homeless population has increased both in Arizona and nationally. So that's increased from 34% to 35% among our Arizonans 45 and older, and then it increased from 4 to 6% in those aged 62 and older. Taking a look at even when there is a household and people have those payments, we are noting the gross rent as a proportion of household income. So here it's important to note that Arizonans 1 in 2 pay a gross rent of 30% or more of their household income. And the conventional public policy indicators, really looking at that 30% mark, having households that exceed that 30% mark can really be a source of stress and can indicate housing affordability problems in those households. Additionally, we note that 81.6% of Arizonans 65 and older reside in owner-occupied housing, and 18% reside in renter-occupied housing units. Among Arizonans 65 and older, 52% have a gross rent that is 30% or more of their household income. This next index, so we took what is referred to as a social vulnerability index, or the SVI, and this is used for emergency preparedness indicators and risk factor, but you'll note on the right-hand side are the different indicators that are taken into account for this index, so anything from socioeconomic status, unemployment, poverty, household composition, minority status, language, and housing and transportation. And they put it all together and identify by county an index score from 0 to 1, with 1 indicating a highest risk in the event of an emergency. So having issues and potential readiness or vulnerability in the event of an emergency is noted there. And we'll note some big blocks from our eastern counties as well as our western counties having a high risk in those settings. An indicator that is not specifically identified in the vulnerability index, but an impactor at that social cohesion factor that we look at for Arizonans. What we note here is we wanted to identify volunteerism. And what we note is that 22% of Arizona's adults aged 65 or older reported volunteering in the past year. Now, we do rank lower than the national estimate over the last 4 or 5 years. So nationally in the U.S., that's estimated at 26% compared to our 22%. Another social piece that we wanted to look at is commute time. So the mean travel time to work for Arizonans is 25 minutes, but we do know that that accounts for the entire state. So maybe our urban populations are faring on the higher range here, where we have less than 10 minutes to our 60+ minutes. But we note that 2% of Arizonans utilize public transportation, but we also know that 77% drive to work alone. So that can really impact what we're looking at, stress factors, and our next measure, which looks at our air quality. And so in 2017, 3 of Arizona's counties ranked in the top 10 worst according to EPA's Air Quality Index. Sheila County, Pinal, and Maricopa County were ranked 3rd, 8th, and 10th. And it's interesting to note that Los Angeles is ranked 11th for reference. So definitely opportunities, and as we noted previously, that was one of our bottom lower indicators in our America's Health ranking. Looking at resources and opportunities to make changes in public health, what we wanted to note here is for Arizona, an estimated $50 per resident are dedicated to public health dollars from state and federal dollars. So that includes CDC and HRSA. So we fall well below the national average of $86 per person, with a public health funding ranking of 47th in the country. Opportunities there.
All right, thank you, Carla. Now you can see from all the data that's been presented, we have plenty of opportunities to improve the health of Arizonans and the communities across our state. So in addition to the work that we're doing at the state level with the Arizona Health Improvement Plan and the state health assessment, the county health departments are also doing very similar work in having county level, community level health assessments, as well as county health improvement plans. So we wanted to take a look at what health priorities are being articulated by the county health departments for the local health improvement plans. So here you can see similar to what we have at the state level for our health priorities, but focusing on things like access to care, chronic disease, having safe neighborhoods, healthy lifestyles, maternal and child health, substance abuse and mental health, etc. So these are important things for us to consider as we move forward with the planning work that we'll do with the next version of the Health Improvement Plan. So another important consideration, kind of how we tie this all together, is considering the research, and you may have seen different variations of this same slide, but the research indicating what factors really impact health and premature death. And while we spend the vast majority of the country's health expenditures on health care, it only contributes to approximately 10% of our health outcomes. Genetics contributes another 30%, and then individual behavior is attributed to about 40%, and then social and environmental factors another 20%. So we know that focusing on those social environmental factors and individual behaviors will help move us closer to health equity. So, and that is what we're trying to do as a state, is improve the focus on health equity. So this slide comes from the Robert Wood Johnson Foundation. We thought it was a really good depiction of the difference between equality and health equity, with equity recognizing that people have different starting points in different communities, and different populations have different needs. And the work of health equity is really optimizing opportunity for all populations. So as we move forward, you might want to think about, what takeaways you have from the presentation, and how we use this kind of data to take action. So at the Arizona Department of Health Services, we'll be compiling some of the data that you've seen today, and as well as additional data into a state health assessment document that will be published in the spring of 2019. We invite you to take a look at our website at azhealth.gov/AzHIP, AzHIP. So thank you so much for your time and attention, and for what you all do for improving the health and wellness of the Arizonans. Thank you.